Welcome to our first actual meeting for Senate Public Health and Welfare. Today, first, before we get started, just a few housekeeping notes for committee and those in attendance. We are paperless, so if you need the minutes, you can go online and look at it. If you are still of the old school and you need pieces of paper to write on or something like that, we will make an exception and provide that to you. If you are a senator that's sitting on this committee, if you are in the gallery watching, it's all electronic. So it is on the website. Everything should be there. If you have any problems finding that, let us know and we'll make sure we get you in the right direction. Senate rules, or the committee rules, have been handed out, I believe. So you should have those in front of you. Nothing's changed from last session, so they're all the same. It's just a refresher for you. And actually, before we get started, we would like, because we have a lot of new faces in our committee. With legislative research, we have Connor Stangler. So Connor, if you would like to introduce yourself, and then Leanne.
Thank you, Mr. Chairman. Connor Stangler, Kansas Legislative Research Department, and I'm one of two analysts on committee.
Good morning. My name is Leanne Thone. I am the other research analyst from KLRD.
Okay. And then our one of our revisors, Jenna.
Good morning, committee. I'm Jenna Moyer with the Office of Revisor of Statutes.
And then also filling in or listening online is Eileen Maw with the revisor's office. So Eileen, we won't make you introduce yourself. She has a lack of voice this morning. So committee, we're going to go right into our agenda. Over the break, there was some news that broke that there was a letter written, and then there was an opinion issued about the anesthesiologist assistants. I know that has been a issue that had a lot of interest in this committee. So we decided to go ahead and have some hearings on it. This is just informational. It is not to debate whether or not any side is right or any side is wrong, or that the issue opinion that was written was right or wrong. All this is just to give the committee information on what happened, what transpired, and to give a little bit of a background on what a anesthesiologist assistant does and CRNAs do, and the difference in what the Board of Healing Arts does and how they come to that decision, and any other conferees. So we will hear from conferees, and then we will open up for questions afterwards. I would ask that the committee keep in mind that this is just informational, and we're not trying to decide who's right, who's wrong, or what was right or what was wrong. Just information for us going forward. So with that, we are going to have a presentation on certified anesthesiologist assistants in Kansas, and our first conferee is Susan Guile, Interim Executive Director for the Kansas State Board of Healing Arts. I think I combined two, so I apologize. I think Susan Guile is just giving a presentation, possibly.
So my name is Courtney Sisman. I'm General Counsel of the Kansas State Board of Healing Arts.
Well, okay, then
I do have Susan Guile, Interim Executive Director, is here as well.
Okay, so I don't feel so bad. All right, thank you. Susan, thank you for bailing me out. This is our first meeting, so we have hiccups. So Courtney, welcome to the committee.
Thank you. Mr. Chairman, honorable committee members, thank you for the opportunity to speak with you today regarding the practice of certified anesthesiologist assistants in Kansas. I'm Courtney Sisman, General Counsel of the Kansas State Board of Healing Arts. Susan Guile, Interim Executive Director, is here with me as well. Before we really get into the substantive part of the discussion, I want to take a moment to orient the committee to the Kansas State Board of Healing Arts, what our function is and what our role is and what has brought us here today. The Kansas State Board of Healing Arts is an executive body tasked with licensing and regulating 15 healthcare professions in Kansas, along with the authorized corporate practice of medicine. Our board is comprised of 15 members, 12 of whom are licensed healthcare professionals and 3 of whom are public members. Our statutory mission is to protect the public, so anything the board does, the decisions it makes, it does through that lens. The board does not create law. Obviously, that is left to the Kansas Legislature. The function of the board is solely executive in nature, in that we carry out the laws and we have to enforce and abide by them. The board, nor any agency in Kansas, currently licenses and regulates certified anesthesiologist assistants in Kansas. And nothing in our written or oral testimony should be construed as a clinical or professional recommendation or lack thereof, or an expression of preference for any profession going forward. So on May 18, 2021, the board received a formal letter from the president-elect of the Kansas Society of Anesthesiologists. The letter has been included in our testimony as attachment 1. The letter requested the board confirm the understanding of the authority of a physician anesthesiologist licensed by the board to delegate the provision of anesthesia services to certified anesthesiologist assistants, which I'll refer to as CAAs, acting under the physician anesthesiologist supervision, consistent with the delegation and supervision requirements specified in Kansas law. The specific question that the board was posed was, does the Healing Arts Act or any other statute administered by the Kansas State Board of Healing Arts prohibit CAAs from performing professional anesthesia services in Kansas within the scope of their certified education and training under the supervision of a physician anesthesiologist who is licensed in Kansas and who complies with the requirements of KSA 6528-127 in regards to the physician delegation and supervision of the professional services by the CAA. The board agreed that in the interest of transparency and predictability in the board's regulatory enforcement, Kansans would be served by providing guidance to our licensees and the public on this topic, which directly relates to the statutes and regulations under the board's jurisdiction, the Healing Arts Act. At the June 11, 2021 board meeting, which is an open board meeting subject to the Kansas Open Meetings Act, the board considered the specific question posed and answered a written formal response. The board's written formal response is included in our testimony as attachment 2. At the outset, to be clear, the Kansas State Board of Healing Arts did not license a new profession and would not do so unless and until the Kansas Legislature authorizes us. What it did in response to the specific question posed was conclude that Kansas law allows CAAs to perform anesthesia services in Kansas within the scope of their education and training under the supervision of a physician anesthesiologist who is licensed in Kansas and complies with the statutory requirements of KSA 6528-127, KSA 6528-37B26, and KSA 6528-37B30 in regard to a physician's delegation and supervision of professional services. This conclusion is based on the plain language of the statutes. It's also augmented by legislative history and relevant Attorney General opinions. Although the Kansas Healing Arts Act generally prohibits the unlicensed practice of any profession licensed and regulated by the board, KSA 652872 subsection G exempts persons whose professional services are performed under the supervision of or by order or referral from a practitioner who is licensed under the Act. In 1998, the Kansas Legislature enacted KSA 6528-127, which importantly was again amended in 2009, which outlines more specific and detailed requirements regarding supervision and delegation for those physicians who delegate the practice of the healing arts to other persons. In relevant part, this statute requires that physicians who delegate pursuant to the statute be actively engaged in the Healing Arts Act in Kansas, review and keep current written protocols with the individual they have delegated those to, delegate only acts which the licensee knows or has reason to know that that the person can competently perform them and is not in violation of any other statute or regulation. Delegate only acts that are within the physician's normal and customary practice. Provide for a qualified substitute licensee for when absent, and comply with all rules and regulations that the board has established regarding the limits and conditions of delegation. A secondary factor, but also important, that the board considered when reviewing this issue is the general value in avoiding actions that could be seen as having an unlawfully chilling effect on professional market competition. Consistent with the board's mission to protect the public and keeping this in mind, the board seeks to generally take a position of a less restrictive on market competition than other available options. Again, the board did not license a new profession and would not do so unless and until the Kansas Legislature authorizes us. It simply answered a specific question that it was posed based on current Kansas law. The board was carrying out its executive function. The board does urge further legislative attention to this issue and specifically give further statutory direction on what the role, if any, these providers should have in Kansas.
Courtney, thank you for your testimony. If you wouldn't mind, would you stand for questions if committee has any? Committee, do we have any questions for Courtney? Courtney, not seeing any. You must have done a wonderful job, so thank you. Committee, our next conferee is Dr. Kathy Perriman, MC anesthesiologist. Dr. Perriman, welcome to the committee.
Chairman Hildebrand, thank you very much for allowing me to come, and honorable members of the committee, thank you for your attention. I have the old-fashioned paper. As you said, my name is Dr. Kathy Perriman, and I'm a resident of Leawood, Kansas. I'm here to speak in support of the Kansas Board of Healing Arts opinion, and I represent myself and the Kansas Society of Anesthesiologists. I have a rather unique background, and that's one of the reasons that I've been asked to testify. It gives me a unique perspective on this topic. I started out my career as an ICU nurse, and I worked for several years in the ICU and then went on to KU to get my degree in nurse anesthesia. I then practiced nurse anesthesia for several years before I decided to further my education and go to medical school. After medical school, I did an anesthesiology residency and then a pediatric anesthesiology fellowship, and I've had the pleasure and honor to practice in pediatric anesthesiology at Children's Mercy for the last 31 years. I have had the opportunity to work with nurse anesthetists all of that time and their student nurse anesthetists. And after Missouri passed licensure for anesthesiologist assistants in the early 2000s, they joined our practice 12 years ago, and I've had the opportunity to work with them and with their students. And we have had a very successful relationship over all of those years. The nurse anesthetists and the anesthesiology assistants in our practice and across the United States and other practices work very collaboratively, and the surgical team can't tell the difference between the nurse anesthetists and the anesthesiologist assistants. Their skill set is very comparable. Having taught them and having worked with them all of these years, can assure you that that they are very competent. Both nurse anesthetists are very competent and anesthesiologist assistants, and very valuable members of our team. We have tried to gain licensure in Kansas for anesthesiologist assistants over the past 5 years, and we've meticulously followed all the instructions that have been given to us by both the Senate and House committees. Just to recap this, we introduced the legislature. We were requested to take this before the KDHE Technical Review Committee, and after hearings in that committee, they recommended licensure by both the committee and the KDHE secretary. We reintroduced the licensure legislation, and we were asked to meet with Kansas Association of Nurse Anesthetists to try to reach a compromise, but they refused our request. Then we later on were asked to do that again, and it's my understanding that they did meet with Kansas Society of Anesthesiologists during an interim session, but there wasn't a compromise reached. So there have been significant efforts to do this, and delegatory authority is certainly a well-known way to accomplish this, and has been done in multiple other states, and has currently been going on in Texas for many years, and Michigan. Other states that started out as delegatory authority have achieved licensure. So that's another pathway. The only difference in our practice and in other practices, the function of CAs and nurse anesthetists is that nurse anesthetists can practice in both states, but anesthesiologist assistants cannot. Nurse anesthetists can also work independently, and they do that in a lot of our hospitals, in smaller hospitals. In the larger tertiary care hospitals, we have care teams. And in Missouri, nurse anesthetists and anesthesiologist assistants both work in that care team very effectively. This would not affect the practices of nurse anesthetists that work independently. I think that's all I have to present. I'm open for questions.
Dr. Perriman, thank you for your testimony. Committee, Senator O'Shea.
Thank you, Mr. Chair. I have a couple questions. You said that they have similar skills, CAAs and CRNAs. What's the difference in the education?
The education in the specialized training programs is very similar, and there's I believe you have access to this this form that I submitted, and the anesthesiologist assistant's background is more like a physician assistant entry, and they have a pre-medical background, and then when they enter their program, it's a lot of clinical and didactics, just like in the nurse anesthetist program. So their backgrounds are different. The nurse anesthetists come from a nursing background. The anesthesiologist assistants are not required to come from a clinical background. Some of them may, and I think that's the main difference.
A bit of a follow-up question. I'm assuming CRNA was created first. So why do you think that the option for AA, if it's so similar, why was that created?
It was created in the 60s because there was a shortage of anesthesiology personnel, and there's been a nursing shortage for quite some time, and when nurses are diverted into APN or CRNA school, it depletes the nursing workforce, and they needed more people in the anesthesiology specialty. So that started down in Georgia, and it's progressed from there.
Senator Petty.
And thanks, Mr. Chairman. And this is a follow-up. So, but do we have CAA programs in Kansas?
No.
So what you're talking, when you mentioned in your testimony about Missouri, they do have CAA programs in Missouri?
Yes, yes.
And as I was looking at, thank you for this comparison sheet, as I was looking at that, so, excuse me, anyone that comes into the CAA program, I see the length of the two programs is about the same, but does the CAAs, what is their I'm having a little trouble following their background. Do they have to have a degree prior to coming into?
Yes.
But just in something else, it doesn't necessarily?
Bachelor's degree in a pre-medical pathway.
Okay. And then lastly, they end up with a master's degree, is this correct?
Yes.
And nurse anesthetist end up with a doctorate.
I think most nurse anesthetist programs have transitioned to that academic pathway now, yes.
Thank you.
All right. I do not see any further questions from the committee. Dr. Perriman, thank you.
Thank you very much.
Committee, this does conclude our testimony for today. Looks like we were able to get through it rather quickly. So if there is nothing further to come before the committee, we will adjourn. Whoops, just a second. Thank you, Mr. Stengler. You saved me on that one. Do we have any bill introductions? And then I've got a couple of comments from some senators. So do we have any bill introductions today? Okay. Not seeing any. We'll go back to questions. Senator Holscher.
Good morning. Thank you. This is good information on an important topic, and I appreciate that. I am curious, in light of the current situation, the crisis with COVID, are we going to be potentially looking at some of that situation? I know last week there was, on Wednesday morning, a conference with CMOs from across the state talking about the severe nature of what's happening. So didn't know, like I said, if we're going to be exploring that soon.
Short answer is not yet. Senator O'Shea.
Thank you, Mr. Chair. And this might be in the document, but what is the pay comparison? Does anyone know?
Dr. Perriman, if you would state your name and who you represent before you
Yes, sir.
answer.
I'm Dr. Kathy Perryman, representing the Kansas Society of Anesthesiologists. And to my knowledge, well, in our practice, there's never been a difference in pay. I can't speak to, I mean, if you're working independently, there may be a completely different pay than in a care team, but I don't believe that that's different.
Senator Petty.
Thank you. And Doctor, could you clarify for us how many locations are on the state of Kansas for CRNA programs? I know KU has one.
I think that I don't know if there's another one in western Kansas. I'm not familiar with it, but I'm sure they can answer that question for you.
Okay, thank you.
Senator Steffen.
Thank you. Thank you for being here. Over your 31 years of practice, do you feel like patients have gotten sicker, more obese, more complicated, and the surgeries in a lot of circumstances have become even more invasive? Do you feel like it's become a more complicated specialty or a simpler one?
Absolutely, I agree with you, Senator Steffen. It's that in a tertiary care hospital, I've seen the complexity escalate over the years, yes.
Committee, do we have any further questions? Senator Thompson.
Thank you, Mr. Chair. Thank you for being here. As I recall from previous year's testimony, and just in Missouri, this is it the CAAs can, or an anesthesiologist can supervise up to 4 CAAs, is that correct?
I believe that is correct.
Do you think a physician can competently keep up with that many things going on at once? I'm just kind of curious on your
I don't think, I've never practiced that way.
Okay.
Maybe the rule,
Yeah,
but that's not the way we practiced.
gotcha. Okay, thank you. Thank you, Mr. Chair.
Senator O'Shea.
Thank you, Mr. Chair. It's been a year since I haven't asked questions. I've got them all. With the programs that are set up with the physician and the CAAs, who administers the anesthesiology and, is there with the patient? I mean, it's hard for me to understand how the physician oversees them. Are they doing the work, or how does that work?
It again depends on the complexity of the patient, but at the most healthy patients, the anesthesiologist is there for the induction of the anesthetic, physically present for the emergence of the anesthetic, the recovery period, and when needed during the procedure, and checks in periodically during the procedure and documents that.
Senator Erickson.
I think we're just getting the cobwebs out, Mr. Chair, frankly. We're percolating now, I think, a little bit. Okay. Actually, I have a question for Courtney, if she would not mind.
And
Thank you,
Courtney, if
Courtney.
you would, before you answer any questions, if you would just state your name and who you represent, please. for
Courtney
those listening.
Sisman, General Counsel of the Kansas State Board of Healing Arts.
Thank you, Courtney. Just trying to think about this, how this works in practice. So you said that the Board of Healing Arts did not license a new profession, but they did conclude that CAAs can practice
Under current Kansas law.
under current Kansas law. So if I'm translating that right, breaking it down, so we're going to have people practicing under current Kansas law who aren't licensed.
Correct, and that creates somewhat of an enforcement difficulty in terms of administrative action. So the way the board would have any sort of jurisdiction over this relationship right now is via the supervising physician. So without licensure, the way current Kansas law is, there's not that predictability and regulatory component.
So you said that the Board of Healing Arts oversees 15 professionals. Do we have any other practicing professionals that you oversee that aren't licensed?
We oversee only licensed professionals. There are exemptions in Kansas law, which this is not necessarily an exemption, it's a delegatory authority statute. But the jurisdictional component comes in through licensure via the supervising physician.
I'll let that percolate a little bit more. Thank you, Mr. Chair.
Yeah.
Thank you, Courtney.
Senator Stephan.
I'm going to wait till she sits down before I ask her to come back up.
To the good senator's defense, he was trying to get my attention before you,
My apologies.
yeah, before you start walking away.
There
And
was a timing issue. And you might have to kind of help me understand this, but it seems like a few years ago that as I was credentialing both at hospitals and with the Board of Healing Arts, that there was a real escalation in documentation and regulation regarding supervision and thus delegation to radiology technologists. And you had talked about how you guys were kind of moving or kind of tried to stay very minimal in that. But I saw a real escalation in that a few years back. Do you have any thoughts on that?
What the agency is doing right now is a review of everything that's on the books in terms of requirements and trying to figure out if what we're asking for, whether it be supervision or any other sort of requirement, is that necessary? First off, is it required by law, and is it necessary to further public interest? So if it's not, if we're identifying it as unnecessary red tape, we're trying to remove that at this time.
Can you help me understand what would be the legal perception or legal difference between delegating to a radiology technologist or a anesthesiology assistant?
So radiologic technologists right now, they have a license. They can practice under that license. There is an exemption under that law that unlicensed people can practice without a radiologic technologist. And I'm wondering if maybe that's what you're referring to in terms of the supervision component, because those individuals do have to have supervision of a licensed practitioner. Where here under delegatory authority, they have to be under the supervision of the physician pursuant to KSA 65-28-127.
Senator Erickson.
Thank you, Mr. Chair. Courtney, are there other professions that have delegatory authority?
This is the only one that the board has formally been posed with, so I'm not willing to commit to others at this point, but there are surgical techs that do practice, and there are other professions. So there are other healthcare professions that are unlicensed that practice pursuant to delegatory authority.
Thank you. Thank you, Mr. Chair.
So that brings a question for me. Would it be possible for you guys to give us this committee a report of all, and I know it might be complicated, but and it could branch out to a lot of different issues, but all current professions or assistants that fall under delegatory authority that are not licensed, and then all that fall under it that are licensed. Would that be possible?
I will talk with my board about that, yeah.
Okay, thank you. Committee, do we have any further questions? Okay, for reals this time. There are no further questions for anybody, so if there is nothing else come before the committee, we will be adjourned. Seeing none, we are adjourned. Thank you, everybody.